Hello, my name is Dr. Deirdre Houtmeyers, and I am delighted to share my final scholarly practice project poster with all of you today. This was a pilot study conducted utilizing equine assisted learning, which we call EAL, with nursing students to reduce stress and anxiety and promote well-being. The reason why I selected this is because most of us are nurses. We know that nursing students experience stress. Evidence shows that engaging horses helps develop non-intellectual and non-rational forms of intelligence. And horses have a keen way of reacting to body language, promoting a learning of self-awareness. They reflect sort of as a mirror what we're giving off. The problem is that now in society, we have an unprecedented amount of stress and disruption. To mention a few, the global impact of the pandemic, the local epidemic of substance use disorders, the social and health disparities that has been come to light on many levels has been very difficult for all of us. And of course, the rapid change cycle of healthcare, the pumps and all the technology changes on a rapid cycle in which the nursing students or nurses are required to learn these different technology pumps, et cetera. So nursing students are particularly vulnerable to stress and anxiety. We go into this because we want to make a difference, but our profession is life and death. So we also see a reduced focus and commitment, beyond traditional approaches to alternate coping interventions. We need to think out of the box on how to help these students and others to increase their coping and increase their presence. EAL uses horses to therapeutically heal humans. This has been going on for centuries, and the literature is extensive around their capacity to do that. And I know that both professionally and personally. The purpose of this DNP Scholarly Practice Project was to conduct a pilot study to evaluate the use of horses in equine assisted learning with pre-licensed nursing students to reduce stress, anxiety, and promote well-being. The practice question was, does participating in an equine assisted learning program decrease the stress and anxiety in nursing students, such as juniors and seniors, and promote an increasing in their well-being? The theoretical framework that I selected was Kolb's experiential learning cycle. This was a perfect fit. It really is a four-staged learning cycle. First, you have a concrete experience, followed by an observation and a reflection on that experience, which then leads to a formation of abstract concepts, an analysis and generalizations and conclusions, which are then used later in a person to test hypotheses in the future situations that they encounter, resulting in new experiences. The methods and methodology was a project design that was quantitative. There is a lot of qualitative data research out there, but I wanted to really measure very specific markers. So it's quantitative, quasi-experimental, pre and post-test design. In this, I'd like to describe that there were 4 stations. The nursing students were all, oriented, and we did all the paperwork and all the IRB, college and barn waivers, and it was an off-mount horsemanship design in which there is no riding. So there were 4 stations, as I said: grooming, and then leading the horse, then leading the horse over an obstacle course, such as cones, and turning them around in a small space, which now these 1,000-pound animals have to trust you, and you have to have that rapport with the horse. And then wind up with the grooming at the end and giving peppermint treats. So we were able to observe the students. There were 11 pre-licensed nursing students, as I said, junior and senior year, that wound up as our sample population and participated in the entire EAL program. We initially had 22 screened students, but for various reasons and commitment, it was during COVID, they had to make up different kinds of requirements. So, but it was 11, which made we were able to measure for significance. The setting was a horse farm in the northeastern part of the United States. The 2 forms of measurement were a 20-item Likert scale. This survey is well verified and validated. It's called the State Trait Anxiety Inventory. It is used in 60 countries and dozens and dozens of times every year. And it also has a capacity to measure health caregiver distress, which I thought was important in this pilot study. We also collected biometric measures, specifically the heart rate, the blood pressure, respiratory, temperature, O2 sat, along with the stay and a 5-item demographic survey, just to see who our population reflected. The data was then analyzed with myself and a biostatistician who ran the SPSS, did Wilcoxon signed rank descriptive, and the level of significance was set at a P being 0.05. The results were that 11 of the nursing students did complete all of the pre and post-test design markers. So 73 initially scored high anxiety on the stay, which was greater than 40 points. The post-test 100% scored a lower anxiety, less than 40. The pre and post was significant in that, and it was measured at a p-value of 0.018, which was statistically significant for change. The biometric, all of them trended in a positive direction. However, the heart rate was significantly different and showed statistical significance in that the p-value was 0.011. So this was really exciting to see that these nursing students, watching them and interacting with them and observing, taking notes. It was an amazing opportunity to see the results of their pre and post just experience. Many of them came with fear, trepidation. They shared all that, but all of them said that this was an amazing experience. The school should offer it. It is in many medical schools, and I'm trying to hopefully explore certain nursing programs that would be interested. I'm in conversations with the school that I went to for my DNP, and there are other colleges that I know would be open to this. The implications for nursing practice is this evidence-based practice findings from the pilot study and the literature review supports the critical need for nursing students to learn how to manage their stress and their anxiety. This will help them increase their presence with their patients, their confidence, and that ensures quality of care, increased safety, There's decreased med errors and just a feeling of satisfaction and that they've done a good job with their patients. The patients benefit, the nursing students benefit, and then really at the end of the day, collectively, there's less burnout, less compassion fatigue, moral distress that many of our colleagues and students describe, leaving the workforce in droves. Leadership could really embrace this type of effective intervention. And that has to start always at the top. And I do think from the ones I've spoken with, nursing leaders are looking for ways to support their students to have a better experience in school and then feel more confident in going into the workforce, being at the bedside and caring for acutely and often critically ill patients. Educators are keenly poised. Academia, they can really provide and encourage programs like this that can mitigate stress and improve well-being in their students. Most importantly, additional research is essential. It needs to be on a larger scale to examine the efficacy of EAL as an innovative intervention to minimize their stress and build confidence and presence and well-being in nursing students. So that's something that I would encourage anyone to do, and I will continue to do it myself. In conclusion, this was a wonderful project. It really showed what we all knew anecdotally and in the research, but it was nice to have that opportunity. So after completing the EAL and seeing that it was statistically significant and hearing from the students in the debriefing group how much it helped and how they wanted it to be ongoing, it motivated me to pursue at least seeing if that's an opportunity for that school. I would like to acknowledge the folks who were with me the whole way through this project. That was my chairwoman, Dr. Valerie Hunt, Dr. Travers, Don Williamson, and then Dr. Jackie Hart, a preventative medical doctor who was with me throughout the entire research and then day of the program. Thank you, and please be in touch. If you have any questions, my contact is available on this slide. Good luck. Thank you.